challenging behaviors, ADHD-like symptoms, sleep difficulties, picky eating, and mouth breathing. What do they all have in common? They originate in the mouth. Orofacial myofunctional therapy, also known as MYO for short, is a therapy that neuromuscular retrains the muscles of the mouth for optimal breathing, chewing and swallowing, respiration, as well as speech. With a trained speech-language pathologist that has myofunctional training in infants, babies can also benefit from a MYO therapeutic approach, which addresses their airway and how their tongue is positioned in their palate to appropriately grow their facial muscles and their cranial bones. If you notice that your baby is chronically congested or is having lymph drainage issues, that can relate back to the muscles of their face. So myofunctional therapy can help with lymph drainage, as well as how well they're breathing and opening up their nasal passages and their airways so that they're able to nasal breathe. How do you know that your toddler would benefit from myofunctional therapy? Typically, our toddlers come in when transition to solids didn't go very well. So we see toddlers that have difficulty coordinating the muscles of their mouth to chew and swallow a variety of foods. We start seeing picky eating as well as disruptive sleep patterns. So we see toddlers that are mouth breathing at night, they're snoring, they're still relying on their pacifier or thumb or finger sucking to get to sleep, which is an airway compensation. They also tend to be our kiddos that have bigger dysregulation throughout their day. That can look like a really anxious shutdown kiddo, or it could also look like a toddler that's having really big feelings and not able to regulate as well as maybe their peers. For a school-age child, they typically get referred to myofunctional therapy when they have a tongue tie that needs to be released or they're needing palatal expansion. So a lot of the times we see in our older patients that they're candidates for early palatal expansion with a really trained pediatric dentist or a pediatric orthodontist. Our school-age kiddos that benefit from MYO typically present with more speech errors. They can also present with more feeding difficulties and ADHD-like behavior that relates back to an airway issue. So our kiddos also can come to us if they need myofunctional therapy before and after a tongue tie release that went missed in the earlier years. Any of our school-age kids that are still having persistent sleep issues, they can look like babies and toddlers that just weren't great sleepers, and now they're school-age kids that snore, they persistently mouth breathe, their nose is stuffy, they have congestion, they potentially could have had PE tubes put in their ears for chronic ear infections, they could have enlarged tonsils or adenoids that were removed or never resolved. Symptoms like that would be things that a myofunctional therapist can target and work on to improve. When an adult needs a myofunctional therapist, they are typically coming from an orthodontist because they've had multiple rounds of orthodontics throughout their years. They've had ortho relapse, so their teeth are still shifting and moving. They also have some swallowing difficulties, or they're having difficulty eating certain textures. If they also have a tongue tie that went missed throughout their life, like me, they are looking for pre and post frenectomy work, and they're also looking to sleep better and breathe better, whether that be during your day, during a workout, or at night. If you're an adult that experiences sleep apnea, sleep disordered breathing, or snoring excessively, it might be time to look into myofunctional therapy. Our adult patients typically complain of TMJ disorder, so they're having issues with clenching and grinding excessively, as well as experiencing orofacial pain, neck pain, shoulder pain that can be related to restrictive fascia and tension that could originate from a potential tongue tie. If you're noticing any of those symptoms, or if they've been persistent over the years, you may be a good candidate for orofacial myofunctional therapy. To get started today or to set up a courtesy phone consultation, contact us on our website.